Hello and welcome to our Doc Talk. Today we're talking about your heart health, and with us is Interventional Cardiologist Mark Villalon, who's going to talk about keeping your heart healthy. So take it away, Dr. Villalon.
Hi, good afternoon. Welcome everybody to Doc Talk here. I am Mark Villalon, one of the interventional cardiologists here at NorthBay. Very, very excited to be here with you all today, especially during this February Heart Month here. The heart is a very, very important organ. We want to make sure we keep all of ours safe. And so I tell people that heart disease happens to be the number one cause, or a top leading cause of death and morbidity, should I say, in all of Americans. So it's something we want to pay attention to. And the most important part to pay attention to is prevention. Prevention is key to so many issues we have in life, and the heart is no different. So I'll start off by saying that the heart is an organ, a very important one. It's a pump. It circulates blood around itself. On the inside of the heart are 4 chambers that do that job. The heart works by pumping, it works by a muscle, and it works by artery and blood flow, as well as a small amount of electricity that keep it pumping. And so when we say the term heart disease, that encompasses a multitude of items such as heart attacks, AFib. It also includes cardiomyopathy or congestive heart failure. And I've just given you the tip of the iceberg there with all of the processes that can affect the heart. So for us, the goal is always to prevent any major heart problem. So it always starts with the 2 big pillars, the 2 basics of prevention, which are diet and exercise. A healthy diet rich in vegetables and fruit, exercise mainly by activities such as walking or other low-impact sports, are keys to maintaining a very adequate heart-healthy lifestyle. But that isn't the total picture. Along with watching our diet, along with watching our exercise, also includes avoidance of sugary foods, avoidance of smoking, stress level decrease, good amount of sleep, and limiting alcohol intake. These are just the basics that I'm describing to you as well. And everybody's body is so unique and different. And if you are one of the millions of Americans living with heart disease, it's certainly not too late to get going here and get started with all of these things we're going to talk about in a few minutes here.
Okay, so can you describe to us, how does the blood come in? Where does it come in? Where does it go out? The terminology to help us a little bit.
Absolutely. So with the heart, this is an open version of a heart, and the heart sits right about here, just a bit to the left of my breastbone, my chest bone here for all of us. And if I opened up the inside of the heart, it's composed of 4 chambers. 2 of them are ventricles, 2 are atria, and blood circulates on the inside of the heart. It leaves momentarily to the lungs, to the blood vessels of the lungs, where it gets oxygen, and it goes back out of the heart to the rest of the body. Heart health is so important because there are so many little pieces, so many little structures that contribute to this very important function. And all of these features help ensure a very healthy heart and healthy lifestyle.
Okay. So what are some of the most common heart issues that you see in your practice?
For me, it's the first one is going to be prevention of heart attacks, and those who have had heart attacks to prevent a recurrence. So that's a very big thing that I see. For those who have had a heart attack or those at risk of one, it's where one of the arteries that feed the heart muscle gets blocked off. That blocking occurs through plaque buildup that occurs over the course of years. And that's what we call atherosclerosis, specifically coronary artery disease. That's a terminology we use as a precursor to heart attacks. And so our goal is to minimize that risk. And so all patients would benefit with a diet rich in vegetables and fruit. And if I had to give one diet, and I don't like to give diets out, but it would be the Mediterranean diet. And I tell people not to diet per se, but rather to make eating healthy a part of your lifestyle, a part of your identity, where you don't have to think too much about it. I also tell people that it's okay to be imperfect every now and then, and the goal is to not be perfect, but to try our best and do as much as possible. Exercise is important. The American Heart Association recommends at least 30 minutes a day of moderate intensity exercise up to 5 days a week and more if possible. We always want to prevent injury, so keeping in tune with your ailments and your limitations from a bodily function standpoint is always important. Staying safe is always important. And apart from that, it's going to be knowing that you don't smoke, and if you do smoke, cutting down and ideally never smoking again. Apart from that, there's making sure you don't have diabetes, one of the millions of Americans that has diabetes, and if you do, you want it well controlled by following up regularly with your physician. So smoking, diabetes, knowing your numbers is important. So numbers include your cholesterol numbers. So your doctor, at least annually for some of you, sometimes every 2 to 5 years, will check a cholesterol panel. You want to own those numbers and really know what they are. I often tell patients take a snapshot of it online or get a printout of it. Either way, you want to be able to own those numbers along with your blood pressure. That's a simple reading that one can take on their own. For some people, I have them, and for all people really, I think knowing your body weight, knowing your size, what size you fit into clothing is always important for purposes of tracking and knowing the change. And I think those are the basic things that I recommend to my patients.
So why is knowing your blood pressure really important when it comes to your heart?
Love the question. Hypertension is elevated blood pressures, and that is one of the most modifiable risk factors that leads to heart disease. And so if we can minimize that modifiable risk factor, well, we can really help a lot of people. So for me, it's paying attention to two numbers, the top and the bottom number, also known as the systolic and over the diastolic. Some people say 120 or 130 as a goal for the top number and lower, and less than 80 for the bottom number. And the goal is to make sure that you routinely, every few weeks, every few months, have somebody check it, if not yourself. But knowing your own numbers is really important to ensuring a heart-healthy lifestyle.
What's the blood pressure doing to your heart if it's too high?
Over the course of time, blood pressure can stress the heart, plus the blood vessels as well, not only in the heart, but for the rest of the body. That includes the arteries of the brain. And so high blood pressure, uncontrolled, is also a major modifiable risk factor for the development of strokes.
Okay. Can you explain the difference between blood pressure versus your heart rate?
Yes, absolutely. So the heart rate is a number of times your heart beats a minute. It's like a metronome for the most of us. All of us have a regularly occurring amount of electricity in our heart that feeds the heart muscle and allows it to squeeze. And we count that anywhere from 60 to 100 beats a minute. Some people are a little bit lower than that. Now, any deviation out of that is a good reason to see your doctor. So the blood pressure is not the timing of the heart, but rather the pressure that it takes that's extruded upon the blood vessels from the heart muscle. And so blood pressure is more of a multifactorial phenomenon, or finding, should I say, that occurs because of the blood vessels.
Okay. And that pounding on the blood vessels is what can cause problems if it's too high.
Absolutely. The pounding over the course of time can really do a number on the blood vessels and affect it negatively.
What's an arrhythmia and what problems can it cause?
The term arrhythmia encompasses a whole host of diagnoses, but one of the more common ones and dangerous ones is something called atrial fibrillation. So an arrhythmia in general is where the heart beats not exactly within 60 to 100 beats a minute and not exactly in time. We call that sinus rhythm. And so when the heart electricity deviates from that norm, it could be an arrhythmia. Now keep in mind, it is normal for your heart rate to elevate. When I exercise, my heart rate gets up to a certain number, and that's expected. If I were sick, if I were in the hospital, I would also, or under stress, my heart rate would elevate as well. Those are predictable responses, but anything outside of that would not be predictable. We call that an arrhythmia. Okay. And there are a whole host of them. And AFib is just one of many types of arrhythmias that I watch out for and all cardiologists watch out for.
Right. It can cause does it put you at a higher risk for heart attack, or?
In general, it can. I wouldn't call it a high risk by means per se. But people with arrhythmias sometimes can have the same risk factors for having heart attack risk factors as well. So people with arrhythmias, we generally screen for other forms of heart disease and do a full evaluation of the heart to ensure that the heart is healthy as a whole.
All right, Anne has posted a question. She's asking, with regards to a healthy diet, can you talk about eggs and cholesterol? I've heard they're okay to include in your diet, but then you've also heard the contrary comments about that.
Yeah, great question, Anne. Thank you for the question. My first response is everything in moderation. I would certainly say that. The second thing I'll say is our diet, to only a small degree does it influence our cholesterol numbers. We can't influence it too much. Now that said, I still encourage people with elevated cholesterol levels to go for that and maximize that very healthy diet. I still say that. I still say in general we want to minimize the amount of eggs we eat in a given week. Now that number could be, it changes a lot between different physicians and different societies and task forces. I will only say that a moderate amount of egg consumption is recommended, and lower is better in general.
Okay. So what are the most common symptoms of a heart attack? How does somebody know that they're having a heart attack and not angina or something like that?
Heart attack symptoms are really hard to understand. The first thing I'll say is if it doesn't feel right to you, then you should definitely seek immediate care. Don't diagnose it at home. Get over to the hospital. But not everybody has the same symptom. One of the more common findings or features is a symptom in your chest. And notice how I didn't exactly say pain, because it could just be a discomfort. It could feel like a fullness. It can feel like a pressure. It can feel like somebody sitting on your chest. The radiation of it up to the jaw, either or both shoulders or arms, is also a high-risk feature. However, there are a lot of people, women, people with other heart problems or like it, that don't exactly get chest pressure or pain or discomfort. They get more of a shortness of breath. They get more of a neck discomfort or a jaw discomfort. So all of these things, I think, if they make you feel uneasy and uncomfortable, and if you're in the certain risk category, I certainly would say come on in to the hospital.
And you brought up risk categories, and I'm going to talk about what are some of the common risk factors people should consider, if they have them.
Absolutely. Age is always one of them. Certainly, just by being the age of 40 or greater increases your likelihood of having a heart problem. But risk factors would be if you have blood pressure problems and need a medication, or if your blood pressure is elevated and you're not taking medication. So hypertension is a risk factor. Having cholesterol numbers that are not optimal is another risk factor. If you're somebody who is smoking or has smoked in the past, that also is a risk factor. Having diabetes and prediabetes also happen to be risk factors as well. And then, of course, having a family history of a first-degree relative, typically a father before the age of 55 or a mother or a sister before the age of 65 who have had a heart problem like heart attack. All of those features increase your risk of having a heart attack.
Okay. Rosalie says, "Hi, Dr. Villalon, from your happy patient." I think she must be a happy patient. Your
Hi,
number
Rosalie.
one patient.
Oh, great.
Okay, so are the symptoms in women, can they be different than what men experience?
Absolutely. It is not uncommon for us as cardiologists to see women having heart attacks without the typical symptoms that a man has. Women can absolutely have it. They can absolutely have chest pain, pressure, discomfort as well. They can go to the jaw, but they can also have shortness of breath, fatigue that is severe, should I say, and sometimes usually abrupt. Usually, not all the time, there is an association with feeling sweaty, cold, clammy as well, though that's a negative finding and feature in your symptoms as well.
How do you tell it from a hot flash?
So difficult. And yeah, no, I can't say I know the answer every single time. I can only say that if it makes you nervous, it makes us nervous too, so come on in. I certainly don't want to recommend everybody flooding into the ER by any means, and I don't want to cause a mass hysteria by any means either. So I think trying to find that balance is a very difficult find.
Okay. So how strenuous does the exercise have to be?
Well, I think it's important to exercise. So the answer lies in who you are. So the answer is tough. I certainly can't give the same answer to everybody. It matters on your base fitness level. It matters on your age. And it matters on how safe you are with that activity. Like if you had back problems or knee problems, well, I won't recommend to really get out there and run really hard. But for a lot of my typical patients, I will tell them that they want to exercise to the point where they can't exactly make a full sentence when they're speaking. You know you've hit an adequate heart rate to make you breathless. And then you want to back off, and you certainly don't want to be there for too long. And everybody's body is so unique and different. You certainly do not have to be breathless for the entire time for an hour or even the whole 30 minutes to get the benefit from it.
All right, Angelita is asking, is your pulse and your heart rate one and the same?
They are. They're the same thing. Your pulse is your heart rate.
So how do you measure your heart rate yourself, like without going to a doctor?
Good. So one way, there's a few ways, but to do it yourself, you can put your 2 fingers on your carotid artery. It's kind of tough when you're talking, so you want to sit there and get your second or index and middle finger. You want to put it up to your neck here, and you want to just feel next to the side of the neck there for the pulse. You wait half a minute to see if you find it. The other place to find it is on your artery, your radial artery. So that you find your thumb there, 2 fingers in the other hand. At the base of the thumb, if you sit there quietly, you can actually, if you wait, you should be able to feel the pulsation. And then you can count for a whole minute, count for half a minute and multiply by 2, or count for 15 seconds and multiply by 4. And that's your beats per minute or your heart rate. And the normal numbers for most people are around 60 to 100 beats per minute.
Okay. So Lana says, I have a bradycardia, is that the way you said?
Yeah.
With an average heart rate of 51 beats per minute. What should my target heartbeat be when I'm exercising?
I love the questions. Thank you for being also engaged. This is fantastic. So, Lana, you must be an athlete. And if you're not, that's pretty good here. I like a heart rate of 50. I didn't get to it, but so I'll give you an example. A lot of athletes have heart rates of about 40 or 41 beats a minute or so. Some of them in the high 30s. And that's because of what's called the vagal tone or resting tone. They've exercised so much. Now, some of us are just born with that proclivity to have that. To answer your question, Lana, 51, 50, overall, that's a great heart rate with one caveat. If you find yourself suddenly, unexpectedly lightheaded, dizzy, or blacking out, well, that's cause for more evaluation. But for most comers, if I just heard that number alone, certainly I would not get scared about that. I would certainly say in the absence of symptoms, like I've said, that probably is a healthy number. And the last thing I'll say about that, some medications can lower your heart rate. Even some eye drops can lower your heart rate. So paying attention to which medications you do or don't take would help as well.
So is there a target they want to reach, though, when they're exercising, like a heart rate target?
So I think it's a controversial topic. What I'm going to say next is there's a lot of opinions here, but what one can look at is your target heart rate, which is a function of the number 220, subtract your age. So let's say I were 50 years old. 220 minus 50 is 170 beats a minute. That would be your 100% max heart rate. So for a lot of people, not everyone, to lose weight or just to stay fit, you want to get to about 80% of your max heart rate, and you don't really need to go much more than that for too long, but just getting to about 80% and then backing off if that's okay with the way you feel is good. So 80% of about 170 is roughly 136 or so, around that number. And so getting to 136 beats a minute at 50 years old, that's pretty good. If you push it for a few more minutes, a little bit above that, no harm, no foul. But certainly you don't really need to go higher than that for too long of a time.
Okay, great. Kathy's asking, can pain in the jaw be caused by pressure from reflux or gas?
Can pain on the jaw? Great question. Okay, in general, no. In general, now everybody's body is unique and different, so I hate making generalized comments because I've been wrong before, Kathy, for sure. But If you ask some of the gastroenterologists that work at NorthBay, they will say that the reflux symptoms can be a whole host of symptoms. I think rarely does it go all the way to the jaw, rarely. I think more commonly it stays just below the neck area.
Okay. And what can a person do to protect their heart? You said diet and exercise. Is there anything else? Are there medications?
That's right. Medications are there for a very narrow sliver of the population. So if you've already had a heart attack or had a stroke, well then you should be on a baby aspirin and you should be on a cholesterol medicine to prevent a recurrence of either of those problems. And then if you're at risk of either of those, and that phrase, at risk, is really an art form as to try to get to who would benefit from those two preventive medications. Certainly I can say this easily, not everybody should be on an aspirin or a statin medicine. They are reserved only for those who would benefit over the small risk associated with them.
Okay. So if somebody has either already had a heart attack or you discover they do have a lot of plaque buildup, what's the next step? What do they do to deal with that plaque that's already built up?
Prevention is the main driver, is the main goal there. Prevention and maintenance of quality of life there. But so prevention is going to be, like before, it doesn't change with the diet and exercise as allowed by your body. And then the preventive medications are very important to make sure that they're in your body every day, if you don't have side effects, of course.
Right. All right. If there was one message that you wanted to get to people about their heart health, what would you tell them?
Ooh, one message. I would say I truly believe in my own heart that heart health is not always preventable, but a lot of it is, and that is by the actions and choices we make every day. And that is the diet and exercise, and that is what I live by myself.
All right. All right, well, we're about out of time. Our next chat will be on March 9th at 10 a.m. with Dr. Seth Kaufman, our Chief Medical Officer, and he's going to talk about the latest numbers and information on COVID and what's happening in that whole realm. So we want to thank Dr. Villalon for being here today. And this will live on as a post, so enjoy watching it at your leisure. Thank you, Dr. Villalon.
Thank you for having me.